I'm Dr. Ngozi Onyea, founder and managing director of Paelon Memorial Hospital. It's been challenging, but it's been rewarding. I've seen Paelon grow from basically an outpatient service with one bed to what it is today. In my prior employment before I started this hospital, I worked for a multinational organization, so I got to know what global standards were like. I realized that stagnation leads to deterioration and that quality improvement should be a norm.
So SafeCare quality improvement methodology is a stepwise approach to quality improvement. So depending on your scoring when you enter into the program, it will determine, first of all, your level. Then based on the assessment, you're given a quality improvement plan, which you must implement for you to move on to the next level.
When a facility shows interest in getting the services of SafeCare, one of the first things we do is perform a baseline assessment, because that's what will tell us where the facility is at, so that we can then intervene and help them move forward. So at the time we assessed Paelon for the first time, I believe in 2014, we came on a level 2. And surprisingly, one of the first facilities to come on a level 2 at the first assessment. And so that really opened our eyes to knowing that Paelon wasn't an ordinary facility in the sense, because before then every other facility was coming on level 1. So after that assessment, we developed what we call a quality improvement plan. Now this quality improvement plan are a set of activities that bridge the gap that we identified at the baseline assessment. So after we developed this plan, we started working with the facility weekly and then gradually to becoming monthly once we understood that they have gotten a hang of the whole process. We continued that process for about 15 months. Then we did a follow-up assessment and they came on a level 5, first facility in SafeCare to ever attain a level 5 in Africa and indeed the world.
When you get to level 5, what that means is that you are ready for international accreditation if you choose to proceed along those lines. Paelon has remained a flag-bearing hospital for SafeCare in Africa as well as in Nigeria by maintaining their level 5 status. And they've achieved this for the second time this year, 2020.
It's been a good experience, like I said, because of clarity of goals and objectives. So there was nothing ambiguous about the process. It was clear where we were starting from, it was clear what was required of us, and it was clear how to get there, and we were guided through the process by SafeCare. I will say we have improved across all our service elements. Now we hold regular clinical meetings and morbidity reviews that help us improve our processes on a weekly basis. We have time to look back at what we have done, what we didn't do so well, what we could do better. We've signed on to an international quality assurance program for our laboratory. So our lab tests are reliable and dependable. We're able to compare with institutions all over the world and come up with standards for our lab tests. We now have routine maintenance of our equipment. We've also upgraded our equipment for better outcomes. So we now have things like infusion pumps on every bed, patient monitors, and equipment like that, syringe drivers that will ensure safety of the patients. We now have a C-arm in our theater, which will improve the efficiency of surgery, particularly orthopedic surgery, and also urological surgeries, surgery in general. We now have better diagnostics for better quality. So for example, we have an endoscopic suite where we're able to not guess that patients have ulcers, but actually diagnose that patients have ulcers. So we've normalized incident reporting. We have a no-blame culture, so people are encouraged to report incidents. And of course, with incident reporting, there are fewer errors, because we're able to put in place things to avoid medical errors.
We have reduced patient stay. If a patient comes into the hospital for, let's say, a surgical procedure or malaria, if you're expected to spend like 3 days in the hospital, your 3 days is 3 days. Because we have processes that guide our practice. We have a clinical guideline for doctors. We have a general guideline for clinical and non-clinical department in the hospital. So with the SafeCare standard, we've been able to channel guidelines specifically to patient care. So we have wound healing by first intention, so we don't have complications from wound infection. So we're able to put in place a proper infection control processes and all. So we have a very good maintenance plan, a preventive maintenance plan that we weren't doing before now. And we also have been able to get more equipment to help our diagnosis process. So we're not doing guesswork. Now we're sure of the accuracy of the test result that comes out from our lab, because it's usually compared monthly with other laboratories around the world. So basically I can say for patient outcome, we have reduced patient stay, we have increased patient satisfaction, we're able to meet their need, and we are sure of having a patient coming back to us for continuous care.
I feel very good, I feel very proud. I'm happy that we've been able to show that the first level 5 wasn't a fluke, that it was indeed something that we do right, that made us earn the first level 5, which is why we actually improved on it for the second level 5. So I feel very happy. It shows the strength of my team effort to be able to do something like that, and there was total buy-in. Everybody worked very hard to actualize and then to maintain as well. In 10 years, one of the reasons why we've been able to attain the strength of our brand equity, I think, is because of the quality of the care we provide. We are well known for quality. Even people who sometimes think we're expensive will come here when push comes to shove, because they are sure of the outcome of what they will get from here. And I think SafeCare has been an important part of that achievement. Doing a quality improvement, I think it's a no-brainer. Every hospital should take it up, I think. That's the way to stay relevant, to stay on top of your game, I think, is to go on a quality improvement journey.
It is very important that as a country, as we seek to achieve universal health coverage, that we pay particular attention to quality improvement, quality assurance, because this is the only way that we can ensure that the quality outcomes are consistent with what we want. There's adherence to protocols, and ultimately the patient benefits, because all the services that hospital provide is really to improve patient outcomes. I think the best approach is adoption of a quality improvement methodology at first a national level, then at the state level, because we need to encourage, through policy initiatives, adoption of quality improvement programs. So that would be the first step. Then the next step is then implementation. As we've seen with quite the number of states that we support, there's a need to build capacity within the ministries of health, because they will be charged with implementing some of these initiatives.
We need more awareness to be created about the fact that that there are quality improvement processes that are affordable and that are available in Nigeria, because definitely compared to the others, SafeCare is more affordable than most. Engaging with SafeCare was a game changer for us, because from the beginning, the objectives and the goals were very clearly spelled out. It was easy working with SafeCare, and we are where we are today.
So ultimately for us, the goal is to move Paelon from being a certified level 5 facility to a SafeCare accredited facility. Very recently, SafeCare developed their own accreditation product. Before now, we used to do certification. And on the certification journey, we reward improvement by levels. So you're either on a level 1 or a 2 or a 3 or a 4 or a 5. 5 being you offering the highest quality in that sense. But we've gone a step further to develop our own accreditation product, and we encourage every facility to take this opportunity, because when you have an accreditation, it places you a cut above other facilities. You become the facility of choice for patients, because when you have the gold badge beside your name, it just makes everyone feel this is where I should be. I personally would prefer to go to a facility with some accreditation than one who doesn't have one. So take the opportunity to be part of the SafeCare accreditation product.